Clear your liver in just 10 days. That sentence sounds like a promise you might see everywhere online. I want to start by saying there is no magic wash for an organ that does its work quietly every second of your life. My goal in the next minutes is to give you an honest, practical 10-day approach that can reduce stress on your liver, steer you away from dangerous cleanses, and set habits that support real regeneration over weeks to months. I'm Dr. Miguel Alvarez, a colorectal surgeon who spends a lot of clinic time talking with patients about metabolic health. And in my practice, I've seen how small, sustainable changes move tests and people in the right direction. If you want practical, science-based tips for gut and liver health, stay with me to the end, and consider subscribing so you don't miss the deeper meal plans and lab checklists I publish regularly. Think of the liver as a factory and filter that never rests. It does many jobs at once. It processes the food you eat into energy and storage. It makes bile to help digest fats. It synthesizes important proteins like albumin and clotting factors. It breaks down medications and hormones. And it clears toxins and metabolic byproducts so they can leave the body. When I explain this to patients, I sometimes use the image of a river system. If debris builds up at the headwaters, downstream life suffers. The liver is that headwater for your metabolism. It stores glycogen to steady your blood sugar between meals, it recycles worn-out red blood cells, and it participates in immune surveillance. These are ordinary miracles of physiology. They are also processes that can be stressed by diet, alcohol, inactivity, and some supplements. In the clinic today, 3 patterns of liver trouble come up more than anything. First, non-alcoholic fatty liver disease, often called NAFLD, or simply fatty liver, where excess fat accumulates inside liver cells and may progress if the underlying metabolic drivers aren't addressed. Second, inflammatory forms of liver injury that are not viral, often associated with medications, alcohol, or metabolic syndrome, where inflammation damages liver tissue. Third, the long-course evolution toward fibrosis and cirrhosis, when repeated injury and scar formation impair the liver's architecture. Left unchecked over years, that risk includes liver failure and a higher chance of cancer. I do not mean to alarm you, but to make clear why modest, early steps matter. Many studies and clinical experience indicate that lifestyle change, weight loss, improved diet, reduced alcohol can slow or even reverse early-stage disease. It takes time. It is not instant. Autophagy and hepatocyte regeneration are real, but they operate over weeks to months, not in a single weekend cleanse. That brings me to the traps. You have probably seen dramatic protocols online that promise rapid liver detox with a cocktail of laxatives, concentrated juices, herbal powders, or extreme fasting. I need to be very clear. Some of these practices are dangerous. Laxative-based cleanses can cause dehydration, electrolyte disturbances, and even kidney injury. Highly concentrated supplements and certain herbal extracts have been linked to acute liver injury requiring hospitalization, and in rare cases, death. Extreme, prolonged fasting without medical supervision can destabilize blood sugar and precipitate arrhythmias in vulnerable people. I have treated patients who arrived after following an aggressive cleanse and ended up with acute hepatitis or profound dehydration. Calm, factual note. I have seen harm from these approaches. Please do not try them without medical supervision. If a method sounds like a shortcut or promises overnight cure, treat it with suspicion. What can you do instead? Over the next 10 days, you can remove a handful of high-risk behaviors and add concentrated, sensible dietary choices that reduce metabolic stress on the liver and encourage healthier function. The first change is simple and urgent. Stop consuming added sugars in drinks and snacks. Sugary sodas, packaged fruit juices, sweetened cereals, and many sauces pack a disproportionate load of fructose, which the liver metabolizes and can convert into fat when eaten in excess. Second, stop drinking alcohol, even the occasional drinks that you might think are harmless. Alcohol is a direct toxin to the liver and adds to any existing fatty change. Third, avoid highly processed, fried foods and industrial seed oils used for deep frying and many packaged snacks. Frequent intake increases oxidative stress and inflammatory markers. Fourth, pause any new herbal or concentrated cleanse supplements and bring them to your physician for discussion. Some plant-based supplements are not benign for the liver. Fifth, refrain from extreme calorie restriction or prolonged water-only fasts without supervision. These 5 stops alone cut out most of the acute harms I see. Now, what to include? Over the next 10 days, focus on 7 foods and habits that, taken together, give your liver a clear advantage. First, extra virgin olive oil used as a dressing and for light cooking. Aim for about 2 tablespoons a day as a general, non-prescriptive guide. Its monounsaturated fats and antioxidants are associated with improved markers of liver fat in many studies. Second, fatty fish such as salmon, sardines, or mackerel. Try to include 2 modest servings over the week for omega-3s that are linked to reduced liver inflammation. Third, leafy green vegetables, spinach, kale, arugula, eaten raw or lightly steamed, which provide fiber and phytochemicals that support metabolic pathways. Fourth, cruciferous vegetables like broccoli and Brussels sprouts. They contain compounds that assist liver phase detox pathways and encourage bile flow. Fifth, coffee. Yes, plain black coffee. Moderate consumption is consistently associated with lower risk of fibrosis and liver cancer across many observational studies. Sixth, nuts and seeds, particularly walnuts and almonds in small daily portions. They bring healthy fats and antioxidants. Seventh, berries and other low glycemic fruits that provide polyphenols and fiber without excessive fructose load. Each of these recommendations carries caveats. They are general, evidence-informed suggestions, not prescriptions. If you have allergies, interactions, or specific medical conditions, discuss swaps with your clinician. To make this practical, picture 3 days as reset, then 4 days of consolidation, then 3 days of stabilization. On day 1, remove alcohol and sugary beverages from your environment. Throw out or donate the easy temptations and replace them with water flavored with lemon or sparkling water. Begin each morning with a source of protein, Greek yogurt without added sugar, or an omelet with spinach, and a handful of berries. Use extra virgin olive oil to dress a salad of leafy greens and add a serving of cruciferous vegetables at lunch or dinner. If you normally cook with seed oils, swap to olive oil for dressings and low-heat cooking and avoid deep frying. On day 2, schedule a 20 to 30-minute brisk walk. Physical activity helps mobilize fat stores and improves insulin sensitivity. Days 3 through 6, prioritize balanced meals. A breakfast with protein and fiber, a lunch built around vegetables and fatty fish or legumes, and a dinner of lean protein, cruciferous, and a grain like quinoa if you tolerate it. Snacks can be a small handful of nuts or plain Greek yogurt. Across these days, aim for adequate sleep, 7 to 8 hours, because sleep deprivation worsens metabolic stress. On days 7 through 10, focus on consistency. Keep alcohol at 0, maintain portion control for refined carbs, and continue daily movement. If you have a sweet craving, choose a small portion of berries rather than processed sweets. Let me give you a concrete swap I often discuss with patients. If your usual breakfast is a bowl of sweetened cereal and orange juice, change to rolled oats cooked with water or milk, topped with a tablespoon of chopped nuts and a half cup of berries, and swap the juice for black coffee or water. The difference in fiber and absence of added sugars means your liver won't have the same acute fructose load, and your blood sugar will be steadier. For lunch, replace a takeout burger and fries, often cooked in industrial oils, with a grilled fish salad dressed in olive oil and lemon. These are small moves, but small moves repeated reset the metabolic landscape. Safety cues are critical. If you notice jaundice, yellowing of the skin or eyes, dark urine, severe abdominal pain, persistent nausea, swelling in the abdomen, unexplained bruising, blood in stool, or new confusion, seek medical attention promptly. These are warning signs that your liver function may be seriously impaired. For most people without these red flags, a 10-day reset is a safe start. Consider baseline tests before and after a more sustained program. basic liver enzymes, ALT, AST, bilirubin, albumin, and a hepatic ultrasound if clinically indicated. If you have diabetes, are on regular medications, have a history of liver disease, or are pregnant, talk with your physician before making major changes. You might ask about intermittent fasting, coffee enemas, or special herbal teas. Intermittent fasting can be helpful for some people when done sensibly and under guidance. It may promote metabolic flexibility and autophagy, but it is not suitable for everyone. Coffee enemas and many dramatic detox rituals carry no solid evidence and can be harmful. Regarding herbs, remember that natural does not mean harmless. Some supplements have caused acute liver injury. Always bring any new herbal product to your clinician before starting it. I want to pause and tell you a short anonymized vignette. A middle-aged patient came to me convinced that a rapid juice cleanse would fix their fatty liver. They had stopped their diabetes medications on their own during the cleanse and developed dizziness and fainting due to low blood sugar. We managed the immediate crisis in clinic, restarted appropriate medical therapy, and then built a gradual dietary plan that included the swaps I described. Months later, their liver enzymes improved and they reported more energy. The lesson I tell patients is not heroic self-surgery, it's careful, steady changes plus medical oversight. On the science side, why do these choices help? Reducing fructose and refined carbohydrate intake lowers the liver's substrate for de novo lipogenesis, the process of turning sugar into fat. Improving insulin sensitivity through weight loss, fiber, and activity reduces the signal that tells the liver to store fat. Increasing anti-inflammatory and antioxidant foods, olive oil, nuts, fatty fish, cruciferous, and berries, reduces oxidative stress. Coffee may modulate fibrosis through multiple pathways seen in observational work. And sleep and movement support hormonal balance and mitochondrial health, which are central to how hepatocytes recover. If you follow this 10-day plan, what can you expect? In most cases, you may notice more stable energy, fewer sugar cravings, and a sense of accomplishment. Blood tests might show modest changes in enzymes over weeks. Imaging changes take longer and are best evaluated after several months of consistent habits. Regeneration of hepatocytes and beneficial remodeling of liver tissue is possible, but not instantaneous. Think in terms of weeks to months for measurable clinical improvement and in terms of lifestyle for durable benefit. Before I close, 2 practical notes. 1. Be cautious with cooking oils and heat. High heat cooking can oxidize delicate fats. Use olive oil for dressings and low to moderate heat cooking, and reserve other fats for recipes that require them with attention to smoke points. 2. Involve a nutrition professional if you need tailored swaps, especially if you have dietary restrictions or metabolic disease. Dietitians and hepatologists are partners, not an alternate to your physician. To summarize, the 10-day strategy is simple. Stop added sugars and alcohol, avoid extreme cleanses and questionable supplements, reduce processed and fried foods, increase olive oil, fatty fish, leafy and cruciferous vegetables, nuts, coffee in moderation, and low glycemic fruits. Add daily movement, prioritize sleep, and seek medical evaluation if you have warning signs. This is not a miracle cure, but a realistic, safe reset that reduces hepatic stress and sets the stage to recovery. This content is informational and does not replace professional medical advice. If you have known liver disease, take chronic medications, or have complex medical conditions, consult your physician before making major changes. If this guide helped you, please like, share, and subscribe. Can continue to produce evidence-informed resources. Leave a comment with questions you want me to address in the follow-up video on meal plans and lab monitoring, and talk to your clinician about a personalized plan that includes basic tests such as liver enzymes and an ultrasound when appropriate. Take care of your liver. It is quietly working for you every hour, and with thoughtful habits, you can give it a real chance to recover.